Bonjour tout le monde. Good morning, everyone. My name is Myriam Boudreau, and I am on the board of the National Association of Federal Retirees, Ottawa branch. I would like to begin by acknowledging that the land on which the National Association of Federal Retirees, Ottawa branch, is traditional unceded territory of the Algonquin Anishinabeg people. Since the fall of 2020, our branch has organized over 50 plus webinars on different healthy aging and financial literacy topics to promote financial literacy and healthy living. We would like to thank you for attending and participating in these webinars. We definitively could not continue without your support. On behalf of the Ottawa branch, I'm pleased to welcome you to today's webinar presented by Leslie McDiarmid and Chandra Vidyanathan with Compassionate Ottawa, entitled Advanced Care Planning Workshop. Veuillez noter que le webinaire sera présenté en anglais, mais la participation bilingue est toujours encouragée. I want to give a special welcome to anybody here who is not yet a member of the association. We hope that these webinars will inspire you to join. And to our members, we hope that these webinars will definitely encourage you to continue to support us and be there with us and participate. Speaking of recruitment, the mega recruitment drive is back. And so from September 1st to December 31st, every time you successfully recruit a new member, you will receive a ballot to win one of our 14 great prizes, including a grand prize of $10,000 courtesy of Johnson Insurance. All members who successfully recruit a new member will also receive a 5 gift card to Tim Hortons. To learn more, please visit the National Association website by clicking the link that I think Erin just put in the chat box. After today's webinar, Erin will send you an email with instructions on how to access some of the resources that will be made available to you, as well as some information on the mega recruitment drive and how to join the association. Remember that you should always feel free to invite non-members to register for our webinars as guests and try us out for free. Today's webinar is an interactive workshop that includes a breakout session. We encourage attendees to turn their cameras on throughout the workshops and their microphones on in the breakout rooms if you feel comfortable about that. Today's presentation by Compassionate Ottawa, in today's presentation, you will be invited into a conversation and facilitated group discussions about values, wishes, and beliefs for personal health care. These conversations are an important part of advanced care planning, which is a way to help you think about, talk about, and document your wishes for future care. These conversations may be the most important ones you'll ever have. There will be a question and answer period at the end of the webinar. Please use the raise hand feature and our Zoom administrators will call upon you or type your question in the chat box throughout the session, and it will be read to everybody out loud for our presenters to respond. So now I'm going to turn the presentation over to our speakers for this afternoon. Thank you.
And before we start, hello everyone and bonjour tout le monde. My name is Jenna Devaraja. I am the program coordinator at Compassionate Ottawa. I just want to very briefly go over the Zoom overview. I think Miriam provided a great overview of what to expect. It is an interactive session. So you have both the chat feature and the raise hand feature to let us know if you would like to share a comment or question. Please note that because we are a bit of a larger group, we'll do our best to get through all the questions and comments we receive. But of course, we encourage you to also share that feedback if you didn't have a chance to share those comments in our feedback survey that we'll receive at the end of today's workshop. I also want to mention that we will be breaking you into small groups called breakout rooms, and you'll be automatically placed into that group. And we'll be using the Go Wish statements, which you would have received in a separate email email. So we hope that you have that handy. If at any point you do feel the conversation is difficult or you find it challenging to be a part of that group discussion, you may leave that and remain in the main group until the discussions are over. So without further ado, that's all for me. I will turn it to our facilitators to start our session.
Well, I'll turn it over to Chandra, who's going to begin.
Yes. Welcome, everybody. We're going to talk about advanced care planning and compassionate Ottawa. It's an important topic that we should learn about. And I would like to go to the next slide. I know Miriam said she would like to, she also suggested or also acknowledged we are located in the unceded, unsurrendered territory of Anishinaabe Algonquin Nation. We pay our respect to the Indigenous elders, past, present, and emerging ones. Now, to continue our slide, what is compassionate Ottawa? This is a very important question for us. Compassionate Ottawa has many prongs. It's a citizen-led movement working with communities to change the way we think of living, dying, death, and how to deal with grief. Compassionate Ottawa helps to strengthen the capacity of the citizens of Ottawa to care for each other in time of serious illness and loss. We passionately believe that everyone should have an opportunity to enjoy the wellness and self-respect until end of life. Compassionate Ottawa strives to empower all Ottawa citizens to be more informed about living well, dying, and death, thus providing a platform to look after oneself, our loved ones, and members of our community. In many communities, including mine, talking about death is a big taboo. A person dealing with death or the loved ones who's looking after them feel isolated. Here, I would like to share my story. I lost my brother in the Air India bombing. Everybody who are here must know about that. And I was lost with guilt. If only I had stopped him from boarding the flight. If only I had given more love and more attention to his needs, this tragedy to the family may have never occurred. I was a young working mother with 2 young boys, busy with my shift work, and the if still continues within me. There was no psychological support. There was only blame and accusations and impropriety all around in the newscast, and daily airing of the bombing site only created more distress. This is just my short story. And here I would like to ask, what Compassionate Ottawa works for you? Compassionate Ottawa works separately, but also in partnership with other healthcare providers to improve healthy outcome. In sum, the Compassionate Ottawa is a citizen-led movement using evidence-based approach, working in collaboration with other community groups to change the way we think of living well, dying, death, and grief, and to strengthen the capacity of people to care for each other in time of serious illness and loss. We subscribe to the Compassionate City Charter with outlines that the role of the civic government, public institutions, and other organizations in creating a compassionate community. We hope to share our success and our failures with other communities to grow with compassionate movement throughout Canada and beyond. The Compassionate Ottawa encourages individuals to share their end of life wishes, communicate with the family, partners, loved one, and in case of single person, with a friend or a designated individual. Ottawa has a diverse community with varying belief system. Compassionate Ottawa is an organization provides a platform to develop their own approach in becoming a compassionate community and developed a shared understanding and need to work together to help others. We work with collaboration with partner organizations with common interests and increase the impact of our collective work. We like to learn more when we come to give these talks from you. You can also learn more about us by visiting our website, compassionateottawa.ca.
So I'd like to talk a little bit about why we are doing this. And I'll just go through a few statistics that you're seeing. 80% of Canadians have given end-of-life care some thought, but less than 20% have an advanced care plan. 75% of Canadians want to die at home. Despite this, 60% will die in hospital. And 36% of Canadians say they have talked to their family about their future care. However, that means 2/3 have not. The stats make you realize that there's a bit of a time-sensitive urgency to start thinking about our future care. Most of us, me included, are baby boomers, and we are going into our aging and finally our dying years. And what we know right now is that there isn't the capacity within the healthcare system to care for all of us at the same time. So there is this critical need to start thinking about what's the kind of care we want? Where might we want that to be? Who do we want to make decisions for us if we're not able to make them for ourselves? So we have this opportunity now to sort of build knowledge, build experience, build comfort about talking around end of life and create different kinds of supports and services within our communities and within our homes. Andre Picard, who many of you know, does a lot of health analysis, in a 2018 Globe and Mail column wrote, "Did you know that an estimated 89% of Canadians could benefit from palliative care in the last year of their life, but only 15% are actually getting it?" And it highlights what thinking about your future care can mean. There are two issues with palliative care. One is capacity within the system, and the other is prompting. So we don't have the capacity within the system to provide palliative care to everyone that might request it. But the other thing is people don't prompt it. It isn't requested as often as it could be to be helpful to someone. I have a girlfriend whose mother died October last year. And while she was admitted to palliative care in the hospital, that took a number of weeks. Once she got into palliative care in the hospital, they decided it was better that she go back to the retirement residence she was living in so that she could be with her husband. And that again took another couple of weeks. So her best palliative care was to be provided in the residence in which she lived. But making that happen was pretty convoluted. It was made worse because of COVID. It was when there were still considerable lockdowns. You couldn't visit people in hospitals. In palliative care, you could, but it was one person a day. So you had to choose between the daughter and the husband. Whereas palliative care in a senior's residence, both could be around her, including her granddaughter. So in this world of COVID, I think we've all been impacted and affected. I don't think any of us have come through this without feeling isolated, feeling disconnected, wishing we could do more in certain situations. Many of us, including myself, have tried to maintain sort of physical distance from people while still trying to provide care for people who perhaps are ill or have had an accident or who are at their end of life. I draw your attention to another quote by Andre Picard. He starts off with this sentence that there's no place like home. He then goes on to say that there have been high rates of COVID-19 in institutionalized care in many countries, but Canada, of course, has been among the worst. And he ends that quote using a quote from Shirley Sharkey, who's the CEO of St. Elizabeth Health. She says, 2 of the key lessons of the pandemic are, home is a safe place to be, and home is where people want to be. And I have 2 93-year-old parents who they just moved into a seniors residence September 1st, but the one we just had. So they lived independently in the country through COVID. And that's where they wanted to be. They wanted to be as independent as they could. They wanted to make the decision when they would move out of their own home. But I have to tell you, it was very difficult because most of their services ended and they still needed support. None of us were vaccinated. My parents didn't live in long-term care. They didn't live in congregate living. So they were not in the first wave of people just because they were 90 to get vaccinated. They didn't get their second vaccination till, I guess it was June. So, you know, you want to go and you want to help them, but you can't touch them, you can't kiss them, you take them to an appointment, you got to sanitize the car and wear masks and leave the windows open. So we've all felt this real extreme distance from each other. Most of us have had, you know, funerals or celebrations of life or memorials of life using Zoom. So, you know, COVID has really impacted all of us. And one of the things I think it's done is it's encouraged us to have some conversations about advanced care planning when we can come together, spend time together and just talk about what it is we'd want. Should we experience end of life or have sickness or accident, especially where we couldn't make decisions on our own. So we'll go on to the next slide. I think I've pretty much covered COVID. Of course, who better to sum up life than Snoopy? Someday we will all die, Snoopy. True, but on all the other days we will live. And that's very true. We will live until we die. Advanced care planning is about all of those days that we live, particularly those days that we live when time is running out. It's about thinking about what's important to us, what do we value, how do we wish to live our life in those very last days? What kind of care might we want? Where do we want to be? Who might we want to have around us? Many people aren't aware of advanced care planning or think it doesn't apply to them. The truth is it applies to all of us of all ages because there is a real unpredictability around death. There's, you know, we don't know how, we don't know when, we don't know if there'll be illness, we don't know if there'll be an accident. The one thing, though, that is predictable is that we will at some point die. So advanced care planning is trying to ensure that all of our living days are lived the best we can in the way that we would most want to live. And with that, I'll turn it over to Chandra.
Thank you, Leslie. In our next slide, it's an inverted triangle. We are going to discuss the advanced care planning and what we should do. The advanced care planning is important to everybody, regardless of the age, stage of life, health status, and it set the stage for future conversation. Advanced care planning involves conversation with people who are mentally capable of sharing their views, wishes, and beliefs, and with a substitute decision maker or the loved ones around them. This can happen, as I said, at any point of life. Earlier, the better. And the conversation should be ongoing because plans can change. The goals of discussion comes next. It's when you start the goals of discussion, subsummary is diagnosed with illness and need to consider the option for treatment and care. And these conversations should be with the family or a substitute decision maker or friends who are appointed as substitute decision maker. The consent of treatment comes way below. Now, finally, when we say consent for treatment, in Ontario, the law requires all healthcare providers must inform and get a consent for a treatment or refusal for a treatment. It's a law. Healthcare practitioners are to be very clear in saying about talking about your illness, the treatment options that are available to you, and if you refuse the treatment, the alternative treatments that are available to you. You have the right to make the decision to refuse the treatment or take the treatment. The basic patient rights is decided between the healthcare provider and the patient. This can be offset only in emergency to save a life. If a person comes in and there is nobody around and needs immediate treatment, then the person will get it in spite of nobody being around there. In summary, the values, wishes, beliefs, and goals are overarching ideas how you think about your health and your living. They guide the conversation between you and making decisions. Advanced care planning, when done when you're mentally capable or cognitive, can support you and give guidance to your substitute decision maker. From here on, we will say as SDM, to achieve your goals, your conversation, and your belief and your wishes. This ultimate decision making by the SDM feels that they have done their best in honoring your wishes and carrying out your plan as decided by you. Next slide tells you two things. The first two parts, advanced care planning, is identifying the SDM and having a conversation about values, wishes, and belief. The two important parts of this is identifying a SDM. The person you identify must be of good health, able to take care of your decisions, and take care of you when you're not mentally capable of taking care of yourself. Having these conversations with them and your loved ones is about what is important to you before, long before crisis sets in. The talk with the SDM, what you talk about when you talk to your SDM is very important, and you should focus on having the conversation right now than to wait at a later time. Here, I would like to tell you a little story again, what to talk about. There's no right or wrong way how you start a conversation. So again, I'm going to tell you a story about from Dr. Atul Gawande book, Being Mortal. He had a friend whose dad was facing decisions about surgery to remove a tumor from his spinal cord. At that time, his option was 20%, leaving him paraplegic. His daughter, Susan, chatted with him the night before the surgery. She was his SDM, so they had a bedside chat. And she asked him, if anything terrible happens to you, how much suffering are you willing to go through for the sake of simply adding time? And what is that is important to you? What happens to you if you become paraplegic? And the answer the gentleman gave was, he said, you know, I can endure a lot of pain. That doesn't trouble me at all. I'm willing to take almost anything as long as I can watch football on the television and eat chocolate ice cream. She was flabbergasted by his answer and accepted his wishes. Next day, he went to the operation, came out well initially, later had bleeding in the site. And this time, there was almost 100% evidence of he becoming a quadriplegic. The surgeon came to check with Susan about what decision that she should make, whether they should go for surgery or not. So she asked the surgeon, if my father has the surgery, will he still be able to eat ice cream and watch football on the television? And the surgeon answered, yes. Then she said, I have no qualms of signing a paper for repeat surgery. She felt she did the right thing by choosing surgery because the father said he wanted to watch television, watch football on the television and have chocolate ice cream. So the father came out of the surgery, had to have a bad year going through rehab facilities. But over 2 years, he recovered enough ability to write 10 more articles in psychology and another book. And after for 7 to 8 years, he reached a point where he was weakened and wasn't able to eat. And the decision has to be made whether he has a feeding tube or to live and get nourished or not. At that point, he was cognitively clear. He said, no, I do not want any further interventions. So they brought him home with hospice. 5 days later, without food and water, as he had chosen, with his lovely family around him, he passed away peacefully, and everyone felt that was right. So here, let me ask you to think about this. What is the football or ice cream must have? Leslie, to you, please.
Thank you. So we are going to give you an opportunity now to think a little bit about what your football and ice cream might be. No doubt it'll be quite different. We're going to go into small groups using a tool called Go Wish. You received Go Wish with a bit of an explanation ahead of this session today, so you likely have had a chance to go through it. Go Wish is a number of statements you will have read, and it's designed to help you think about and express what's important to you if you were to be living a life that might be shortened by serious illness or accident. So it's sort of, if you're coming to the end of your life, what would you like it to look like in terms of what's important to you? Who would you want to be around? What would you want to still be able to do? So it's really just a prompt to encourage you to reflect on your own wishes, values, and beliefs. We're going to ask you to go into small groups. Jenna will give you a little explanation again in a moment. And you're going to look at those statements and pull out what's most meaningful to you. Just pull out maybe 2 statements, and there may not be anything relevant to you. You may have tweaked them a little bit, or you might have come up with something totally different that is more in line with your own values, wishes, and beliefs. So when you're in the small group, we'd ask that you take a look at the statements or come up with your own. Reflect on why they're important to you, and then have the opportunity within your small group to share the statements you've chosen and why they are as the most important to you. We'd ask that you make sure everybody has a chance. Only a couple of groups will have facilitators. So we'd ask that you make sure that everyone in the group who'd like an opportunity to share has that. We also know, as Jenna mentioned, that sometimes these can tweak a bit of emotion in us. So we certainly understand that. And if you need to take a break or go get a cup of tea or a coffee and come back a little later, that's fine as well. We would ask that if you are participating in the small group, even if you choose to pass, that you leave your mic and your camera on. The other thing you might speak about is if you've ever had these conversations with a friend or someone in your family, what was that like? Because that's an important part of this conversation as well. So as mentioned, there's no right or wrong answers. We'll give you some time. Jenna will go over kind of the time frame, how we're going to cue you when it's coming to an end. And then we'll have an opportunity to come back into the large group and share some of the highlights of the small groups. So, well, welcome back, everybody. We're going to take just a few minutes now to come back to the large group and perhaps share some highlights of our conversations. We don't want to identify anyone within our group, but we're sort of asking you to think about, what did you learn? Was there anything that surprised you? What was it like having this conversation in a small group? So we're really asking for any highlights or anything that you might want to share with the larger group. We don't have too long for this, so we'd ask you to use the raised hand function that Jen is going to explain to you, and we'll just bring some of those thoughts to the large group.
Yes, thank you, Leslie. So I think if most of you are on your computer, you'll have the raised hand function on the bottom tab of your Zoom screen. So you may need to click on the More button and you'll probably see the raised hand option there. And for those of you joining on a device, such as a tablet or a phone, you'll need to click on the More button. Again, there should be 3 dots. And when you click on that, there will be a drop-down menu to choose raise hand. And then I'll call upon you one by one to share your comments or questions. Oh, and we already have one from Alexandra. And oh, you may go ahead.
Yes, I found this very, very helpful. Thank you very much. We had a nice conversation, and in the beginning, my elements that I focused on were the ones that pointed towards being well organized in order to prevent arguments by making sure my family knows what I want. That's item number 22, and there are quite a few around those that were really, really important. The other finding we had a little discussion on was number 4, which is to be able to talk about what scares me. I find that is something that's very important, and not to assume that that conversation would take place with a member of the family. Depending on the relationship, sometimes it's easier to have those conversations with someone a little bit removed. So it depends on the individuals. So those were my highlights.
Thank you, Alexandra. Were there any other individuals who would like to share what was discussed or share their statements with the group? Oh, I have, so I believe Gay was first, so you may go ahead.
Thanks. Our group looked at to be mentally aware and not being a burden on my family. And certainly on the mentally aware, it was we came up with, it was very important that we had made our wishes known, and so many people haven't obviously not done that. And when it came to being a burden, there was concern about the whole situation of people being in long-term care and not being able to access them necessarily through COVID, and not necessarily having had a clear understanding of what they knew what they wanted done, but it didn't necessarily happen there too. So we recognized that basically we would be having to look after, somebody would have to be looking after us. And the question was, to what degree, I guess.
Thank you for sharing, Kate.
Others might want to add to that in our group.
And I believe Claudine was next, so you may go ahead. And you'll just need to unmute Claudine.
Okay, yeah. Hi, we were a very small group, and we chatted about like I have family and the other person didn't, so that was a different perspective on this exercise. We were trying to find ice cream and TV, watching something that's kind of helping and pretty clear cut, like which is not that simple. For me, it was like to be with my family if possible, because by then who knows where the kids are going to be and if we're all going to be around or not. But if not to die alone. But we started, she was questioning more, and I started wondering, like, okay, so what is it like? I want to live, like, we were trying to find that chocolate ice cream thing, and I said, well, I think I would like to be able to enjoy my family when they come and visit, but when that's no longer a possibility, either I'm too drugged or I don't recognize them, or you know, like it becomes a burden on them, or they don't like coming to see me because I look terrible, or it's not a good image, my eyes are rolling up, or whatever, that maybe also they could, you know, that would also be a reason for letting me go. So but it's not a clear cut like that chocolate thing, you know what I mean, like, and watching football. So yeah, it's not that simple as it looks. So it's good to talk about it.
Yeah, of course.
Yeah.
Thank you, Claudine. And we see we have a few more hands up. And so the next, I believe, was John Carter. So I've just unmuted you and you may go ahead.
Yep. So actually, the one thing I found really, really interesting was a suggestion by one of the members of our group, Linda, who said she picked the wild card as one of her things. And I was really surprised. And she said, part of this is passing on your knowledge and experience that so often we don't, I guess. You know, I thought, well, I was talking about the experience of my parents who had lived through the Depression and the Second World War, and that had affected their conduct and their thinking for many, many years later. We're about to go through the same thing with COVID. And it's going to affect society for many, many years after. You know, we may not recognize that now, and we won't recognize it until, you know, it's always like history isn't really recognized until the events have passed. But I thought the thing about passing on our knowledge and experience, our life lessons, was a really, really interesting point. And if we don't, the world is going to lose a lot of experience and a lot of expertise.
Absolutely. And I think it's a good point to consider for sure. Thank you, John. And our next commenter will come from Suzanne. Oh, and I've just unmuted you. You just need to accept.
So in summary, it seems that we all wanted to have family around us and to share good moments and memories, funny and happy, because in the long run, that's all that's going to be left with them once we're gone. And to make sure that everybody knows your plan so that there's no tension and there's no uncertainty about what should be done. And I also used the wild card where I could use the medical aid in dying if ever I had a terminal diagnosis and I was in a lot of pain, and make sure that everybody knew that. So that's it.
Thank you so much, Suzanne. And I believe that we're, I guess, all the participants who would like to share. So I'll turn it back to Leslie and Chandra.
Great. Well, I just want to, I'm going to turn it over to Chandra, but I just wanted to take this moment to just thank people for participating in the small groups and for sharing some of that with the larger groups. Chandra?
Yes, thank you, Leslie. In the next slide, we are going to talk about how to start a conversation. We kind of talked about it in our group, and there are no right or wrong way, but these suggestions can help. So you can start a conversation saying, I need you to help me with something. Or you can say, I was in a workshop today and I would like to share some information I learned with you. Or the reports from the long-term care due to COVID is scaring me. And I would like to talk to you what happens if I get sick. Or you can say, oh, my doctor told me to have this conversation with my family. Or you can say, I like to talk about my future health. I constantly worry what will happen if I get too sick. And I would like to have this conversation now because I would like if you people can follow my wishes and go ahead and talk about your wishes. As we all pointed out, COVID-19 has done a lot of good things and bad things. The good things are very few, bad things are a lot. So we will just focus on good thing. One thing is we have learned to live with COVID. We never imagined we would be isolated. We would be saying to people, don't come within 6 feet of me. We never thought we will not invite a neighbor into your house. So COVID has taught a lot of bad things, but the few good things is how to take care of ourselves. What happens to us when we get sick. In this next slide, there was question of whether there can be a two substitute decision maker. So we are going to talk a little bit about who can be your substitute decision maker. And first, the substitute decision maker for you must be a healthy person who can follow your wish, your ideas, and your message to either for the treatment or withdrawal of treatment. They may not have the same belief, but they are willing to follow what you want. And as we say, healthcare providers are governed by law. They have to discuss what is important to you. And so when the healthcare provider gives you supposedly say a diagnosis of cancer, they have to say what percentage of you, the disease is curable, what percentage is not curable, what are your options of treatment, what are your options if you don't want to get treated, and then give you the suggestion to wanting a treatment, signing a consent, or not wanting a treatment and signing a consent. If you are not able to do that, then your SDM will come in. And as I said, no consent without capacity. So you have to be mentally capable and cognitive to give a consent. And there is no treatment without consent. So these are the things that one has to be. So what is an SDM? First, he should honor your wishes, be a strong advocate for you, be comfortable with the healthcare situation, be calm in crisis, and able to handle conflict if the situation arises. Now, if you did not appoint an SDM for you, the Healthcare Act will appoint an automatic SDM. They will go through your hierarchy and say, then there's a booklet which outlines all the hierarchy. So the person highest on your hierarchy will be given an SDM. They have to be over 16. They should not have any criminal convictions. They should not have any separation disagreement, and they are willing to assume the responsibility of giving or refusing a consent. There are two people involved. Suppose there are one brother, two sisters and one brother, all are SDM, and they all must agree. And if there is a conflict, there can be a conflict resolution person who interferes with it. And if there is no resolution, then an office of public guardian or trustee will take over and make the decision. And now I hand it over to Leslie for the next slide.
So as Chandra mentioned, we all have a substitute decision maker. So the law provides for an automatic substitute decision maker. And when you get the Speak Up book, you can see how that falls out. So, you know, if you're in a relationship, you know, it's your common law partner, your husband, your wife, then it would fall to children, or it might be children, parents of a child. So you'll see that it sort of runs through typically family members. Now, it's possible that you would prefer someone else to be your substitute decision maker, someone that perhaps is on the hierarchy, but not at the top. Or it might be you'd prefer a friend or a neighbor or someone else that you would like to act on your behalf should you not be able to make decisions for yourself. So if you want to identify a substitute decision maker that is not at the top of the hierarchy, then you can do that through a power of attorney for personal care. It's a very, very simple form. You can have a lawyer draw it up for you, or you can go to the website of the Office of the Public Guardian and Trustee. Simple form, you would identify the person that you want to be your substitute decision maker. You would sign it, and you would have two witnesses sign it that are obviously at arm's length, so there's no conflict of interest. If you're choosing someone not on the hierarchy, or even if you have someone on the hierarchy, you need to really think through how you want to have the conversation with them. You want to tell them what it is that you want. You want to have, it's an ongoing conversation. You sometimes change your mind about things. But it's important to have the conversation and then allow them the opportunity to accept the request or to decline it, because it is a responsibility to act on behalf of someone else. I have a friend who, she has 3 children, and she is single. Her husband passed away, and she typically, what would happen if she was single, it would fall to the children, all of the siblings. They could identify one if they wanted, but in her case, she doesn't feel they do that. She just thinks they would all argue. So she's identified via power of attorney one of the children. So that child will be the one that will make decisions. She felt it would be very difficult on her daughter to have to make some of the decisions to meet her requests. So she's chosen her son. So you can choose anyone. It could be a friend, a neighbor, whomever. But if they aren't top of the hierarchy, then you need to do it through a power of attorney for personal care. One more thing on this. I want to distinguish between a power of attorney for personal care and a power of attorney for property. They are separate and distinct. So the power of attorney for property cannot make decisions for personal care unless they happen to be the person at the top of the hierarchy. So it's really important to understand that when you do the property power of attorney, it is distinct and separate. They're 2 different documents, 2 different forms. So you just want to keep that in mind, and don't make an assumption that if you have a power for property, that it will also apply to personal care. One other point on this, and that is that for those folks who live alone, and we can actually go to the next slide, who live alone and who don't have family, they may find it more difficult to think through who might be someone that could act as a power of attorney for personal care. And it's a bit tricky because it's a difficult sometimes conversation. People can be uncomfortable with it. It takes time. So you may want to appoint someone, but again, I just want to mention, even if you don't, you will have a power of attorney for personal care. So the Office of the Public Guardian and Trustee, it will default to them. They will become your power of attorney for personal care. Now they will seek someone else. They will look at the community and the resources and connections that you may have to see if there's someone that could act as power of attorney, but it will default to them. So for those folks who live alone and do not have any family, there's some other kind of avenues you can think about. Those might include, and the list is endless depending on your own circumstances, but if you live in congregate living, if you live in a seniors residence or a co-op or something where people tend to come together for various groups, or you may be more close to someone, you might start an individual conversation, or you might want to have a group conversation that's facilitated. Compassionate Ottawa could facilitate a conversation in a group. So just that people then start thinking about, well, who might be someone that I could have a more personal conversation with, who might be willing to accept the responsibility of being a power of attorney for personal care. Or if you go to community centers and you're involved in various groups at community centers, you might be involved in a book club or some sort of faith group. So these are all avenues where you can seek out perhaps discussion groups around advanced care planning, and see if you might connect with someone through those, or at least get people thinking about it, because a number of people are in the situation of needing to think outside of the hierarchy and want to identify somebody other than the Office of the Public Guardian and Trustee. So I'll turn it back to Chandra.
Thank you, Leslie. Now we're going to talk about advanced care planning, the 5 steps. In summary, what we talked this hour. Now we will email you these 5 steps to you at the end of today's session. So first thing you will say is think. When you say think, you want to ask, would I live a year? Or would I want to do what I want to do in 1 month to live, or what I want to do in 1 week to live? So you have to think at the end of life and how you want. It's not a sad thing. It brings you joy to live happily at the end of your life. So in thinking, there is no right or wrong answer. You have to understand your health. And in order to understand your health, you have to ask these questions. Is there a good chance that my illness will be cured or managed? Is there a good chance for me to maintain my quality of life after treatment? For example, as long as I'm able to return to my usual activities, or as long as I'm able to take care of my own personal needs, which is important to us. And many of the treatments may cause side effects. And will these side effects be so large that will affect from parents and friends and loved ones spending time with you? Or will the trade-off not taking the treatment, you're able to spend more time with them? The second thing is decide. That's what we learned. And next we go to decide. What did we decide? 1 or more people are able to speak for you if you cannot speak. So you have to look through your hierarchy and say, who will be your SDM? And remember the SDM, you have to have a conversation before you get critically ill with your SDM, conveying your wishes, conveying your belief, and making sure they're able to take care of your wishes and belief. You can also complete a power of attorney for personal care and pick someone else, as Leslie told you about. But before you pick someone else, you have to have a conversation with them. You have to talk about your values, wishes, and belief with your substitute decision maker, your family, your friends, and the healthcare provider. By sharing your beliefs and wishes to your SDM will make things more comfortable for you and the SDM, as in case of Susan. You can record your values, your wishes and belief in advanced care planning guide, a letter you can write or a poem. Many of you are gifted in writing, or make a video or audio recording. In Ontario, you can share your wishes in any way you want. So you can, as I said, write or have a conversation or write an email. At any time, you can change your mind. Just remember, you communicate with your change of plan to your SDM so that it doesn't surprise them. And as I said, the most recently expressed wishes will always apply, and you will be only it'll be used when you're incapable. As long as you are cognitive, you make all the decisions. These wishes and talks and beliefs will be only used if you're not cognitively there. And last, things to remember: how to start a conversation and decide on the substitute decision maker and putting a plan together. These are the important things. And as I said, conversation is a gift. We should be able to express ourselves and communicate our wishes. And advanced care planning is not one-time event. You can continuously update it and change and have a conversation with people around you. As you say, friends, book clubs, even a social meet is nice to have a conversation. Zoom has made it easier for us to have conversation. So let's make it easy on you, easy on your family, and easy on your loved ones. Leslie?
I just want to add something to that section, if I could. I actually saw the question pop up as well, but it's related to this section, and that is this living will, or some people call it an advance directive. So in Ontario, there is no legal basis to those. So a healthcare provider cannot turn to a piece of paper to make decisions. They must get a decision from a person, whether it's you or your substitute decision maker. So a living will is very helpful. It can be a part of advanced care planning or an advanced directive because it can very clearly identify the kinds of care that you want or don't want. But that cannot make the decision for the healthcare provider. It still falls back to your substitute decision maker. So it's like a great reference for your substitute decision maker, but it is not a legal document in Ontario, whereas a power of attorney for personal care or the person identified on the hierarchy is. So the living will, advanced care directive, those are resources that can be really helpful for the family and substitute decision maker, whoever that might be. So with that, I know we don't have much time and there may be a couple of other questions, but maybe I could ask Jenna just before the questions to take a look at them, see if we've answered any already, and maybe we can pull a couple up if we haven't and then go to the resources.
Absolutely. I believe there were a few questions, and I believe we may have answered some in the course of the workshop. I do see Adge has raised her hand, so you may go ahead and ask your question.
Sorry, I made a mistake. I'm not asking the question.
No worries.
I'd like to just add here, Jenna, as Leslie said, the substitute decision maker must be present with you when these decisions are being made. Very important, a paper cannot be there. The person has to be there. So
yeah,
when
they
you
don't have to be physically there, though. I mean, it can
physically
be
there, yes. And
well,
that is important when you choose a substitute decision maker.
Well, I think though that there are lots of healthcare facilities that will also allow it by telephone or Zoom or various other virtual means. I think Jenna can clarify.
Nowadays, yes.
Yes, so for those, if you have an SDM who doesn't live in the same city as you, they can be called on. And so we do recommend that if they are not living with you, that they are easily reachable by phone if a healthcare provider needs to speak to them.
Were there any other questions, Jenna? Or shall we go to the resources?
I believe that we have answered the ones that came through the course of the presentation. So I will share my screen to show everyone the resources that we'll send after today's workshop. So after today's workshop, you'll receive a feedback survey. So of course, we welcome your comments on how we did today, as we'll use that to improve our future sessions. And you'll also get this resource sheet. So it's an online resource sheet. And so you can click on the links and it'll take you to some more in-depth resources. So the first one actually would be quite important here, the Speak Up booklet. It goes through the hierarchy very in more detail. It goes through all the concepts and terminology that Chandra and Leslie spoke of today. Here are the 5 steps, as Chandra mentioned, just for quick reference. It's just a nice one-pager. And for those of you who are looking for hospice palliative care programs or services for yourself or your loved ones, here is an excellent resource. And as mentioned, you can do your own power of attorney for personal care here. So you don't need to use a lawyer. I believe you just need 2 witnesses to before you sign the document. So you can just access it here. And we did create a conversation guide in-house from one of our volunteers at Compassionate Ottawa. And it's a very useful tool if you want to find ways to start this challenging conversation with your family and loved ones. We have a couple of more resources here. So Making My Wishes Known. So there's some online workbooks that'll kind of help you explore your values, wishes, and beliefs. There's a Plan Well guide, and that's a useful tool if you want to learn more about medical treatments and the impact that may have on your quality of life and what you would or would not want for yourself. And we have actually created frequently asked questions on MAID. This may be pertinent to you, so we'd recommend that you click on this if you would want some more information. And we do also offer some interesting videos, and you may also use this as a bit of an icebreaker when you do approach this conversation with your loved ones. They do talk about how to start the conversation and why it's important. And finally, if you want to reach us for more information or just keep in touch with in terms of our events that are upcoming, you can follow us on our Facebook page. You can see what we're doing on our website and also reach us by email here.
Great, thanks, Jenna. One other thought came through the small group I was sitting in on. One person had an older mom in her 90s, and one person had a son. And the conversation with the mom or the son was somewhat difficult. And I was expressing that I have this with my parents as well. And one of the suggestions was, I think I'll just take this Go Wish sheet and go through it with them and see, and it's a simple way. Just take the sheet as a good starter of what, you might want to talk about. So we're just about out of time. I'll just reiterate, we'd very much appreciate the feedback survey because we're always trying to tweak this and do it better. So I think in closing, I'd just like to say on behalf of Chandra and myself, we really appreciate you being here today, participating in our small groups, and we hope you'll continue to have these advanced care planning conversations, either with the people in your life who are important or perhaps some of the groups you participate in where having that conversation would be helpful to a number of people. So with that, I'll just say thank you for being here and turn it over to Miriam.
Merci beaucoup. Thank you all for your participation in today's webinar. But the Ottawa branch would like to really thank our presenters from Compassionate Ottawa, Leslie, Chandra, Jenna. Thank you so much for what you did for us today. And I'd like also to thank our volunteers and staff at the Ottawa branch and Erin Higgins, our program coordinator, for all their help in making these webinars possible. Just a quick reminder for all to look for our follow-up email which will include the information that you've just talked about, the resources, and also your contact information. We truly appreciate your participation and support. And remember that you can invite non-members to attend our webinars. Please check for the upcoming webinars on the Ottawa branch website. The link is in the chat box. And again, thank you again for your participation. Thank you, our friends from Compassionate Ottawa. That was just wonderful presentation. Thank you so much. Merci.
Thank you.
Thank you.
Thank you, everyone. Have a good day.
Merci.
Thank you.